Have you noticed that conversations about healthcare reform generally offer only two solutions? Either continued complex fixes of our current system or adoption of a single payer approach. There is, however, a third choice, a unified healthcare system proposal called Embrace. Embrace is a new idea, an idea that was conceived by 21st century healthcare professionals and designed to create a 21st century American healthcare system. Although it may first appear quite revolutionary in its concept and breadth, it mostly draws on many well-established and proven American processes. It is designed to replace most of the dysfunctional aspects of the American healthcare system while preserving many of the best and most popular parts. To understand why Embrace offers a unique approach to healthcare reform and the logic behind its innovations, we should first spend a few minutes discussing our current healthcare system. For over a decade, it has repeatedly been shown that the American healthcare system is by far the most expensive system in the world, and yet it is not very good at keeping us healthy. This chart shows relative healthcare system performance and spending in 11 high-income countries. As may be seen, the United States is an outlier in both high spending and poor performance. What do all these other countries with more efficient and more effective healthcare systems have in common? Some are single payer and others allow private insurance. But all of them have a system that is unified under one oversight body. What about the American healthcare system? How is it organized? The answer is not easily summarized. First, there is our public or government-funded system. The majority of our public healthcare system is overseen by the Department of Health and Human Services, or HHS for short. This government body oversees 3 health insurance providers and 3 agencies, including Medicare, that insures based on old age and disability, Medicaid, that insures based on income and young age, Indian healthcare, that insures based on ethnicity, the Food and Drug Administration that oversees drugs and medical devices, the Centers for Disease Control and Prevention, which controls much of the nation's public health, and the National Institutes of Health, which funds most of our nation's research that is not sponsored by drug or device companies. Despite all of these being under the direction of HHS, Congress funds each one of these entities separately, leading to long and acrimonious political arguments. More importantly, it makes it very difficult for HHS to develop cogent long-term plans or strategies. Another publicly funded healthcare agency is the Department of Veterans Affairs healthcare system, which is an independent healthcare system available based on one's military service history. And then there is our private healthcare system. Despite the perception that private healthcare is one entity run by private insurance companies, it is much more complicated. Over the years, private insurance has seen the development of various organizations, networks, and programs. HMOs, PPOs, EPOs, clinically integrated networks, and the Healthcare Exchange Program are just a partial list of private insurance schemes that have grown over the years. Each of these often has its own set of patients, its own set of providers and hospitals, and its own set of rules, making them mini autonomous healthcare systems. This diagram attempts to capture the complex interaction of our system. As you can see, there are three circles. The blue one, representing the public system under HHS, contains the CDC, NIH, FDA, Medicare, Medicaid, and Indian healthcare. The green circle represents private insurance containing HMOs, CINs, EPOs, PPOs, and the healthcare exchanges. And the red circle representing an independent VA. What can also be seen is the complex interactions that have developed between the private and public systems. Almost half of Medicare and Medicaid have become privatized, while HMOs have started to include Medicare and Medicaid patients. And with the Affordable Care Act, many private insurance plans obtained from the healthcare exchanges are publicly subsidized. And yet, this diagram is an oversimplification. A couple of years ago, the Senate Joint Economic Committee released this chart of our healthcare system. Although it was a partisan attempt by the Republican members of the committee to mock the Affordable Care Act, it does make the point that the American healthcare system is very complex, even chaotic. And it also begs the question, if you want to reform this system, where do you start? Do you do what lawmakers repeatedly do and pick 1, 2, or 3 areas to reform in this complex web and hope your actions will cause the right combination of interactions to achieve the desired results with no unintended consequences? Or do you completely replace it and rebuild it from the ground up? And if we decide to completely replace the system, what do we choose to replace it with? What would be the most important priorities of this new system? Some of the priorities for an ideal healthcare system might include achieving universal patient access to at least basic healthcare services. This would be a dramatic change from our current system that limits access by age, employment status, ethnicity, military service, and what type of health insurance one has. Another priority would be healthcare services that are based on the latest scientific evidence, something that sounds great in theory, but is almost impossible to implement in our current system's infrastructure. Another priority would be affordability. This has become an important issue lately as out-of-pocket costs like insurance premiums and co-payments have risen. Then there is transparency. Currently, health insurance plans are complicated and extremely variable. The consumer rarely knows all the features and limitations of the plan he or she has, sometimes with devastating results. A fifth priority is accountability. Ideally, our healthcare system should be run by healthcare professionals rather than by lawmakers and for-profit insurance companies, as they are in our current system. And a final priority would be to eliminate the oppressive bureaucracy that has developed for healthcare providers, which reduces their efficacy and efficiency. This bureaucracy comes from dealing with private insurance hurdles and has been estimated to cost hospitals about $200 billion a year and office-based practice about $150 billion a year. It also includes the growing bureaucratic burdens of documenting quality measures, which takes time and money, yet with little evidence to show that the practice improves outcomes or quality. And it also includes the burdens of medical education and maintenance of board certification, which also takes a lot of time and money without evidence that it improves clinical outcomes or quality. Embrace is the only healthcare reform proposal that meets these priorities. Embrace is an acronym for Expanding Medical and Behavioral Resources with Access to Care for Everyone. The plan has 3 major innovations that are designed to work together: an evidence-based tier benefit structure, a health information platform, and a national medical board. Let's start with the evidence-based tier benefits. This is divided into 3 tiers. Tier 1, basic healthcare benefits, covers conditions determined to be life-threatening, therapies shown to be life-extending, preventative services, and all the workups needed to rule out or rule in Tier 1 conditions. Tier 1 conditions might include heart attacks, cancer therapy, and diabetes care. Tier 2 supplemental healthcare benefits covers conditions and therapies to improve quality of life, as well as therapies for Tier 1 conditions that may not have enough scientific evidence to be included in Tier 1. Tier 2 conditions might include chronic back pain and knee replacement surgery for osteoarthritis. Tier 3 luxury healthcare might include cosmetic surgery. The reason why the tiers are separated is because of the way they are covered. Tier 1 coverage is automatic, free, and universal. It covers everyone from cradle to grave, is fully portable from state to state and job to job, and offers full access to every healthcare provider. Tier 2 may be covered by affordable and transparent private insurance. Unlike with the Affordable Care Act, which mandates that everyone be covered by insurance, Embrace will have no mandate to purchase Tier 2 insurance. Because of this, there may be individuals who might have to pay out of pocket for Tier 2 services. Keep in mind that all Tier 1 services for these patients will be covered, and most Tier 2 services would be elective, so paying out of pocket would not burden the patient like it might in our current system. Finally, Tier 3 services will be out of pocket, as is currently the case. The second innovation is the Health Information Platform. It is an internet-like closed network that will be available to every licensed healthcare provider. Every patient encounter will begin with a universal billing form, which would act like a home page. It will use the current well-established coding systems and will be linked to the electronic medical records. After the UBF is finalized, the information is sent to a central computer that would analyze the data and make an automatic tier allocation. Once the tier is assigned, an immediate payment determination is made based on the tier. If the encounter is determined to be Tier 1, the provider would be paid immediately. If it is determined to be Tier 2, the computer would search its databanks to see if the patient has Tier 2 private insurance. If the patient has insurance, the insurance company would be billed and the provider paid. If there is no insurance, the patient would be billed and the provider paid. If it is Tier 3, the patient would be billed and the provider paid. In addition to its billing function, the HIP would also allow rapid accessibility to patient records that are kept in the central computer. This means that any connected healthcare provider would have immediate access to the patient's medical records and to all testing and monitoring. And these would not only be reports of the tests, but also the images and raw data. This would allow the provider to reanalyze the test if needed and maybe avoid the need to repeat the test. The HIP would also offer the opportunity for entrepreneurial application development similar to how Apple opens its iOS platform to developers. Instead of video games and dating apps, the HIP developers would develop clinical software for electronic medical records, home monitoring, and image readers. The only stipulation would be that all of these software applications would be fully interoperable. The third innovation of Embrace is the National Medical Board. The National Medical Board is modeled after the Federal Reserve Board and would be politically independent, would unify the entire U.S. medical system, and would have a national healthcare mission to promote the health of all Americans. The NMB would be chaired by a physician with experience in public health and healthcare economics. Like the Federal Reserve, there would be a board of governors with representation from all areas of the healthcare system, including public health, HIP administration, tier system administration, and medical education. An advisory board would allow input from the pharmaceutical industry, device companies, private insurance, businesses, and other interested parties. And since there is significant regional variation in healthcare across the country, the NMB will have regional chapters. For those who might not be familiar with the Federal Reserve, it was created in 1913 during a chaotic period of the American banking and monitoring system due to lack of economic oversight and infrastructure. The creation of the Federal Reserve System has been credited as one of the most important developments in making the U.S. economy the best in the world. So why not do the same thing for healthcare? Like the Federal Reserve oversees the entire American banking system, the National Medical Board will oversee the entire American healthcare system. It would oversee healthcare access by unifying private and public health insurance. It would oversee drugs and devices, replacing the FDA. It would oversee healthcare research, replacing the NIH. It would oversee the HIP central computer, which would allow it to monitor and manage public health, replacing the CDC. And it would oversee postgraduate medical education. Funding for the NMB would come from one annual congressional bill instead of the many funding bills that are currently needed. This diagram shows the proposed structure of the Embrace Unified Healthcare System. Notice that the NMB will have control over the entire healthcare system, including medical research, the health information platform, the tier system of public and private insurance, drugs and devices, and postgraduate medical education. The creation of this unified healthcare system will offer many advantages to many different groups. This includes patients, healthcare professionals, public health, government, hospitals, businesses, and even private insurance companies. In the interest of time, we will review these four groups: patients, healthcare professionals, public health, and government. Patients and consumers of healthcare would see tremendous advantages under Embrace. It is designed to be user-friendly and affordable. In fact, Tier 1 services would be free and everyone would be covered automatically. This automatic inclusion into Tier 1 means that there would be no enrollment requirements like it is under the individual mandate in the Affordable Care Act. Everyone would be covered from cradle to grave, job to job, and state to state. It will cover all emergencies and preventive care, and there would be no out-of-pocket fees such as annual fees, deductibles, co-pays, or penalties for seeing a doctor or going to a hospital outside the insurance company's network. Tier 2 coverage by private insurance would be affordable and transparent due to the way it would be formulated and offered. These Tier 2 plans would be formulated by the National Medical Board to meet the need of various consumer groups, such as elder care, veterans, or even workmen's compensation. These insurance plans would be offered to the consumer in a menu similar to the Medigap menu. The Medigap program was started in 1990 and offers supplemental private insurance for original Medicare recipients to cover what has been termed the donut hole in Medicare coverage, such as the 20% deductible fees on outpatient and hospital observation care, co-payments, and other uncovered services. When consumers want to purchase Medigap supplemental insurance, they will first encounter this menu of plans. There are 10 columns of choices, A through N. If they want full-service plans with all the bells and whistles, they might choose Plan F, which provides most of the features. If they want the more basic plan, they may choose Plan A or Plan K. Once they find the plan that is best for them, the consumers are guided to another menu that informs them which private insurance companies offer that plan, what extras the plan may include, and the price. This allows for a more transparent method for choosing private insurance than the healthcare exchanges offered under the Affordable Care Act and allows for better price comparisons. Embrace would offer a similar method of buying Tier 2 insurance, but would have different choices in the column on the left. For the healthcare professionals, Embrace would also offer many advantages over the current healthcare system. It will create a science-based system run by healthcare professionals. It will eliminate or greatly reduce administrative overhead, especially when dealing with insurance. Because of the reduced administrative chores, it will allow more time for clinical practice. It will provide instant credit for most services rendered. It will enable easy and inexpensive integration of EMRs into practice. It will allow healthcare providers to gain easy access to patients' medical records and testing, and it will seamlessly integrate continuing medical education and maintenance of board certification into clinical practice. The unified healthcare infrastructure created under Embrace would have profound effects on American public health. It will construct an infrastructure designed to take advantage of 21st century technology and innovation, and provide truly universal health insurance coverage. Run by healthcare professionals, it will have an independent national medical board guided by a national healthcare mission, will provide a representation from all aspects of the healthcare system, establish a mechanism for guideline-driven clinical practice, integrate healthcare research with healthcare delivery by commissioning studies specifically for guideline development and focusing on optimizing tier assignments, which would be more clinically relevant. Embrace will also encourage a greater focus on prevention, and because of the built-in health information platform, would allow for universal registries with little effort or expense, provide a mechanism to automatically perform Phase 4 studies on all drugs and devices, which is currently expensive and unreliable, and enable immediate identification of outbreaks and epidemics, much faster than is currently possible. And finally, let's look at the advantages of Embrace to government. After all, unless lawmakers find benefits, it is unlikely that they would be interested in promoting the plan. Embrace would offer a bipartisan method to accomplish truly universal coverage for basic healthcare services. It will check, or more likely reduce, public healthcare expenditures both for federal and state governments. In fact, since states would not have to fund Medicaid and most of the state government employees would have Tier 1 coverage, it would virtually eliminate healthcare spending by the states. Embrace would eliminate healthcare-related federal agencies such as HHS and the VA. It would stop the impending bankruptcy of the Medicare Trust Fund, which is now projected to occur in 2028. It would eliminate the individual mandate to buy private health insurance, a very controversial part of the Affordable Care Act. And it will eliminate the business mandate to provide employees with health insurance, another controversial requirement of the Affordable Care Act for large companies. So now that you've learned the need for Embrace, how Embrace works, and some of the benefits for various groups, hopefully you may want to advocate for it. The first step is to simplify the message and advocate for a unified healthcare system. This term promotes the concept of a single public-private healthcare system under Embrace. It also differentiates Embrace from a single-payer system, which is often proposed as an alternative to our current system. Unlike a single-payer system, Embrace allows private insurance participation, which, in turn, would save on public expenditures on healthcare, maybe as much as 40 to 50% over single-payer. In addition, single-payer would be a government-run agency, which is unpopular in many political and economic circles. Embrace would be run by healthcare professionals independent of the government. So in summary, our healthcare system is a mess. Embrace offers a unique alternative: universal coverage for basic healthcare needs, an evidence-based healthcare system run by healthcare professionals, a modern infrastructure allowing 21st century innovations, and a model that uses many tested and, frankly, made in the USA features. A Federal Reserve-like National Medical Board, a Medigap-like menu for private insurance, maintaining current practice diversity, maintaining current hospital diversity, allowing entrepreneurial development of healthcare apps, and keeping the current coding systems. This was a very brief introduction to Embrace. If you are interested in learning more about it, please read Embrace, a Revolutionary New Healthcare System for the 21st Century. It is available on Amazon and on Kindle.